Welcome to Dentlings. I'm Josh Tawil, and I'm very happy to present you this patient with multiple impaction. The patient, as he presents, has 4 wisdom teeth to be extracted, and he has an impacted second molar. And the wisdom teeth had to be extracted. The problem was whether we would keep this second molar, mandibular second molar, and do orthodontic treatment or simply extract it. So we proposed to the patient an orthodontic treatment consisting of extracting the mandibular left wisdom tooth and placing an orthodontic device to drag the second molar in place. The patient refused, wanted to have all teeth extracted. So we took a cone beam CT to see how the tooth is erupting, talking about the second molar, and you can see from this cone beam CT that the tooth is erupting in a buccolingual direction with the apex of the second molar anchored in the lingual cortical plate. That can cause a problem because the apex may be ankylosed and the tooth then will pose difficulties in extraction. And we have 2 options, either extracting the tooth or doing a coronectomy. In that case, we started here the surgery, did an incision, a distal incision, and a relaxing incision on the mesial side, anterior side, mesially. Full thickness flap was elevated at this stage. We start exposing the wisdom tooth using Fisher burr. We can use a round burr. We can use a round burr and then we use a Fisher burr. Round burr in this particular case. Using a Fisher burr, the tooth was sectioned, separating the crown from the root portion. Once this is done, using an elevator or a separator, the crown of the wisdom tooth is removed. And the root is luxated and extracted. After the extraction of the wisdom tooth, an osteotomy had to be done to expose the impacted second molar that was erupting in a buccolingual direction, and testing whether this tooth was ankylosed or can be extracted. This we cannot tell before luxating it. So we start by using a round burr, exposing the crown of the impacted second molar. Bone is removed on the buccal side and on the mesial side in order to place an elevator and try to luxate the tooth. Bone on the lingual side is removed to facilitate the extraction. And then using an elevator or a separator in that case, we try to luxate the tooth. And in fact, the tooth was not ankylosed and could be removed in one piece. Again, in that case, if the tooth was ankylosed, we would have most likely to separate the crown and do a coronectomy. But it was not necessary in that particular case. The tooth is now extracted. The site is curated from any remnants from the pericoronal cyst, and then flap is released and sutured in place. This is the site sutured following the surgery and the healing 2 weeks post-operatively.